Ladies and gentlemen, good morning, good evening, good afternoon, wherever you are in the world. I know that we've got a very international audience drawn from across Asia Pacific, and there's even some people from Europe that have joined us, although I appreciate it's rather early morning in that part of the world. My name's Will Alstein, and I'm joined today by one of my colleagues, Gavin Ellison, from YouGov, who heads up our government, public and not-for-profit division within YouGov, and also delighted to be joined by Sarah P. Jones from Imperial College London. Good morning, Gavin. Good morning, Sarah. We are going to be taking you through a rare glimpse of behind the scenes of the types of data that scientists are using to fight the pandemic. And Sarah is going to talk a little about the science and try and sort of draw back the curtain on what is going on in terms of the way that people are, and policymakers and public health organizations are thinking and modeling in order to fight this pandemic. So that's our overall running order. What I'm first of all going to do is talk about YouGov's 3 strands of work before I pass over to Gavin. But just a couple of housekeeping things, if I may. We would be delighted to answer your questions and have left time at the end of this webinar to answer those questions. In order to ask us a question, please do use the chat function in Zoom here. It should be open now, and that will go to all panelists that are on this call so that we can then run through as many as we possibly can afterwards. Just to cover off that we will also share a copy of these slides with everyone who has attended afterwards. So you don't feel as though you have to scribble endless notes, and there will also be a recording made available as well to make you aware that if you missed the very start of this, we are recording this session. So without further ado, let me first of all talk about what YouGov's priority is right now. And ever since the pandemic broke, what our YouGov's global CEO and founder has said is that our mission is to serve the public good. And what does he mean by that? He means giving everybody across the world the opportunity to contribute to the discussion, to offer their views, opinions about the pandemic, and helping to curate that data into a meaningful data set and deliver that to organizations that are making a difference, that are bringing the fight to the virus. And that is very much YouGov's priority. So, and that is why we partnered with Imperial College London, and is why Sarah is on this call. That is first and foremost our mission, delivering on our mission to serve the public good. So we've developed 3 types of data that are available, and the one that we're going to focus on today is our behavioural data. So this is designed for public health organisations and policymakers and covers health-related behaviour, symptoms and compliance or willingness to comply with data. Gavin will take you through that. Just to make you aware, this is a first for YouGov as well. We've gone open source with this data. So it is actually available as respondent level data in GitHub, and I have left the link down there should you wish to explore it at a later date. But to be clear, YouGov, and to draw differences, because for those of you that have tuned into this webinar before, What we have been talking about is our consumer monitor. We've given you a glimpse behind what is available on subscription, and that covers our levels of concern and trust, changes in media spend, changes in consumer consumption, economic confidence and employment, and crucially, what are the new consumer behaviours going into the future. Now that is available on subscription on 8-week blocks, and should you wish to explore that data further, please do ask us either for the previous webinars so you can have a look at those, or email us at info@yougov.com and we'll get back to you. There is a pillar in between, and that is our public data. So this is designed for everyone. And when I say everyone, I mean absolutely anyone with a computer. This is data that YouGov is publishing on its website in interactive charts spanning 27 markets, and it's available at yougov.co.uk/COVID-19. And that covers some headline measures in terms of fear, support for government and support for government actions, and personal measures that people are taking to avoid COVID-19. So those are the pillars that we are talking about. Our behavioural data, which is designed for public health organisations and policymakers, which Gavin is now going to take us through. Our consumer monitor, which is designed for our clients, which has a more commercial aspect to it. And then our public monitor, which is headline measures, which is available to everyone. But let's get into the meat of this presentation, and I'm going to pass you over to Gavin Ellison. Gavin.
Hi everyone, thank you for tuning in for this webinar. As Will says, I'm going to take you through some selected highlights of the behavioural data tracking study that we have created in partnership with Imperial College London. So this is the partnership that we've created there, as Will has explained, is designed to deliver data in a form that is usable by academics and public health organisations and governments around the world. So to ask the right questions in the right way and to deliver the data in the right formats for any organisation that is interested in using that data in its modelling or in just understanding public behaviour. So we created, in partnership with Imperial College London, a common questionnaire which covers the following subjects in detail. So there are questions in the study about symptoms, about isolating in response to those symptoms, a person's ability and willingness to self-isolate if it was necessary. We were interested in the number of times that they were leaving the home, the number of people that they were coming into contact with, sort of inside and outside the home, the number of times they were typically washing hands, for example, and those things are important when it comes to modelling. So it's not just sort of asking people how often they're doing things and the response options being very often or quite often, but if you can ask them in a numeric way to get them to estimate, say, the number of times they're washing their hands or the number of times that they left the home on the previous day, and then you can track that over time, then having that numerical data is very useful for modelling behaviour and change. And then we had some, sorry. We also had some questions around compliance with preventative measures, some mental health questions, and some questions have also been added locally by engagement that we've had through local public health organisations and academics have added questions just in particular countries. Couple of extra subjects that are coming along. We are just started to do a deep dive on everything related to masks and face coverings, and also on vaccinations. The study covers 29 countries, helpfully marked on this map in red. So there's a global focus to it. It began on the 31st of March, so has been running every week since that point. There's been a survey every week in 10 of the 29 countries, and there's been a survey every 2 weeks in 19 of those countries. So over that period of time, we've now gathered around 100,000 responses from people around the world. Importantly, every response that we've got in has been date stamped, so very important for tracking behaviour over time. And we have been collecting some basic information that helps with the analysis in terms of demographics, so age, gender, region within each country, and interestingly, any pre-existing health conditions that the respondent had. The focus for this webinar is those countries in Asia Pacific and the Middle East. And there's a list of the countries that we're covering there. In this case, in the cases of Australia, China, and India, each of those countries has been covered every week, and the rest of the countries in that list have been done every 2 weeks. And so far, there's 2 waves of surveying in those countries. So to get into some of the questions that are covered, we'll go through a few examples and what they're showing. So this is a comparative chart showing the percentage of people who, if the need arose, believed that they would take the actions to self-isolate if they developed symptoms of coronavirus. And it varies from a high in Australia of 79% down to lower figures in China and Taiwan. Generally, for this question, you would see higher percentages among women than men. So, for example, in Australia, 83% of women said that they would, compared to 76% of men. And again, perhaps predictably, it rises very sharply according to age. So in Australia, 71% of 16 to 29-year-olds said that they would self-isolate. And that rises to 90% of those who are aged over 70. 88% of all retirees in Australia said that they would self-isolate. And so it's an indication of how important it is to look at the various demographics behind the data to understand that there are sometimes subgroups of people who are more willing and less willing to take action. This is another interesting way of looking at the data. So the ability, the feeling that you would go and self-isolate if you developed symptoms, but crossed by whether you were working outside the home at the current time. So this example is for China only, and shows some of those types of professions where they are working outside the home, and how that varies. So the ones the professions where there's perhaps the greatest concern that someone wouldn't go and self-isolate if they were developing those symptoms might be, say, for example, the logistics, transportation profession, whereas those who are working, in policing or prisons would be the ones who are most likely to take the steps to self-isolate. We're interested not just in a person's willingness to self-isolate, but also whether they feel that they have the ability to do so. And this is something that is of big concern to policymakers, and is often reflective of demographic differences in society, whether people feel they have the ability or the support structure or around them that makes it easier or harder to go into self-isolation. And we can see some of those differences quite starkly between the countries that are covered by the study. So in Japan, for example, around 40% of those who are in their 30s or 40s feel that it would be quite difficult for them to self-isolate. And in South Korea, 45% of those in their 60s feel likewise. So some differences there in terms of age groups. Generally speaking, it is easier if you don't have children in your household to self-isolate. So around 62% of those who have no children in the household would say that they have that ability to self-isolate, compared to 55% who have got, say, 3 children in their household. So this question relates to whether there would be advice that was given to you specifically because perhaps you had developed symptoms and you had been to see or had a conversation with a healthcare professional, or someone else in your household had developed symptoms, and so effectively you were being told that you really ought to self-isolate. And this is the willingness to do so following that instruction, and how it varies from a high in Vietnam to a lower figure for Japan and in India. Now, in India, for example, you can see some of the stark differences on the basis of age. So just 2/3 of those who are aged 16 to 29 said that they would be willing to self-isolate if they were told, compared to 81% of those in India who are in their 50s. And as I think everyone would expect, and it's good to see, many of those who have got specific healthcare conditions that would be related to age, they would be much more likely to take those actions. So particularly that's those with high blood pressure and high cholesterol. What's a little bit more worrying is that those with, say, asthma or diabetes among the under 40s, the figures are a little bit lower for those. So although their age group is lower, they still have a condition such as diabetes, and so the figure for the under 40s with diabetes is just 69%, which is a little bit more concerning. And the data, as explained, is being captured every week, so it does allow trends to be analysed. And there's the beginning of a trend that you can see there in India, for example, with the willingness to self-isolate if needed, declining over time with a 10 percentage point drop from 77 to 67 from the start of the study up to the week commencing the 4th of May. Face masks is something that is going to be increasingly of interest as the study develops. Then there's a very stark difference between the frequency of wearing a face mask in places like Thailand, Vietnam, Hong Kong, etc. Between there and then, say, Saudi Arabia, Singapore, and Australia. In Australia, men are more likely than women to be wearing a face mask outside the home. According to the study, 27% of men compared to 22% of women. Younger people do say that they're more likely to do so, which may be that they feel more comfortable in doing so, but might also be related to the fact they might be more likely to be going out outside the home. There's no sort of sustained evidence of actually an increase over time yet, but we would expect that to be the case. But in the specific example of Singapore, there's been a dramatic change in time. So we had 40% of people reporting that they that they always or frequently were wearing a face mask outside the home when the study began at the end of March. So that's 40%, and it's risen to 95% in the most recent wave of the survey. So a huge increase in Singapore. The frequency of washing hands with soap and water does vary across countries. There's a great degree of consistency between, say, South Korea, down to Hong Kong, but then starts getting less frequent for Japan, UAE, Taiwan, and China. Afraid to report that men are less likely to be frequently washing their hands, and younger people as well, compared to older people. So in China, in particular, say 67% of 16 to 29-year-olds are doing so, compared to 74% of those in their 50s. But there is higher levels of hand washing among those with pre-existing health conditions, which is encouraging to see. We can show the frequency of washing hands across time as well, which does again show a sort of trend decline. This is just in China and Australia, but you can see that in both countries, the line at the top is Australia. People always or frequently washing their hands, and in China, always or frequently, going from 74% down to 67%, so a sort of steady decline over the weeks, which might be a cause of concern. And this is an example of the numeric data that I was mentioning. So a number of the number of times that someone was washing their hands on the previous day to when they took the survey. And shows the countries in which hand washing is more frequent, with a high range of 21 times or more. Obviously, depends what profession you might be in, but yeah. The average number of times that someone has been washing their hands, so 10 times for women, 9 for men. And those who have children are washing their hands a lot more often, but that could be due to homeschooling and craft work that they're doing with their children, perhaps. And this just displays that information around the average number of times that someone has been washing their hands on the previous day, and how that varies across the countries that we've been looking at, from a high in the UAE of 17. Down to a low in China of 5. So that's a snapshot of some of the data that is available through the tracking study with Imperial College. It is, as we mentioned, available through a number of different formats. So there is open data repository on GitHub, where you can actually get the raw anonymized respondent data. And it's placed into there just a couple of days after every wave concludes, and there's various sort of supporting documentation on that site as well to enable you to navigate the data. Imperial College have a navigatable dashboard, which interestingly also includes some separate information about government policy interventions. And then there's the general web pages at YouGov, which are a sort of source for everything, including the public data stream that Will mentioned at the beginning of this webinar.
Fantastic. Thank you very much, Gavin. Really interesting to see some of those international comparisons across the Asia Pacific region, and the added insight there in terms of looking at the dynamics of gender, of age, etc. Right. We are now moving on to talk about the science, and I am delighted to have with us from Imperial College London, Sarah P. Jones. Just to give you some background on Sarah. So she is a doctoral researcher in the health behaviour at the Institute of Global Health Innovation at Imperial College London under David Nabarro. David is one of 6 COVID-19 special envoys to the World Health Organization. But she's not just a researcher by any stretch of the imagination. Sarah is also the former global marketing director of LVMH brand De Beers. So she brings a unique skill set, able to marry both the science and, like many people on this call, the world of marketing, and it comes together in essentially nudging consumer behavior or nudging population behavior. Sarah's had research published all over the world, including in Health Affairs and the World Economic Forum, and is a peer reviewer in the Journal of Medical Internet Research. I think I'll do for sort of an introduction, but Sarah's going to give us a peek behind the scenes, looking at the science, and hopefully sort of talking about some of those stories that you're seeing in the media headlines, and giving you the underlying view from what the scientists are thinking. Sarah.
Good morning, everyone. Imperial College London, and specifically the Institute of Global Health Innovation, has been working very closely with YouGov offices in 29 countries since March to get data and insights into the hands of researchers around the world who are urgently in need of real-time data. It would be difficult to imagine a more pressing time for data companies to offer data for the public good. And I know I can speak for all of the scientists and researchers involved in our Imperial College London YouGov collaboration who have benefited from YouGov being so generous with the data when I say thank you. On the screen, you can see where the data researchers are using the data which is available to the public. Everyone on this call is able to access those 2 sources. COVIDdatahub.com is produced by the Institute of Global Health Innovation at Imperial College London, and of course the GitHub site is where all of that data is available to be downloaded. If YouGov clients have questions about how to use that data being provided by YouGov to Imperial College London, or have questions about the models behind what we will discuss today, please don't hesitate to contact info@yougov.com and they will put you in touch with me personally. There are 4 main activities that we are working on together to support the research community and those who are providing policy and guidance to countries around the world. The first is COVIDdatahub.com. This is the publicly available dashboard created by the Imperial College London YouGov collaboration. It's updated daily with new data, including the Johns Hopkins case and death data. We track consumer health behavior related to COVID with the aim of developing timely insight bulletins, which we share with our research network, and of course, making that data and the visualizations of the data available to anyone who needs it. We are collaborating with and informing other researchers. I'm contacted every week by other researchers who are also using the data for various scientific projects. Now, our close collaboration network of researchers includes epidemiologists, public health experts, especially those here at Imperial College London, behavioral scientists, and practitioners such as the behavior risk team at the World Health Organization, economic collaborators such as Jeff Sachs, well-being expert John Hallowell, and the entire World Happiness Report team. And I'll touch a bit on that in a moment. So if we move to the next slide, and I'm going to ask Will to hit play. One of the most important factors to consider when looking at behavioral data is the policy context in which consumers are operating right now. And researchers such as ourselves are gathering policy data about how stringent restrictions are from a source provided by Oxford University that you can see here. It's a free service to the public. You can see here the visualization over time about restrictions on public gatherings and how they've taken over the world very quickly. This type of data is available in numeric format from Oxford University. It's also resident on the Imperial College London YouGov dashboard at coviddatahub.com. Now, why is this context so important to researchers? And why do you also need to track this data? Now, in order to control unchecked virus transmission and virus reproduction rates, it's essential that the public performs the kind of public policy behavioral measures, such as those recommended by the WHO, at the right time. When researching why and how health behaviors are occurring, it's very important to consider the context in which they're happening. This helps researchers to unpack big differences in behavior and attitudes. And by tracking the policy context, it's possible to start unpacking these changes. One useful way of doing this is comparing differences in behavior between countries operating under higher stringency policies at the moment and those with lower stringency policies. So for example, among the higher stringency countries, 69% of people are avoiding going to shops always or frequently versus 51% in lower stringency countries. We track this to understand more about how people's collective behavior is changing over time in relation to health policy, with the hopes that researchers can understand better how these behaviors affect transmission rates. However, I bring this up here because these types of behavior have clear implications for brick and mortar shopping. By tracking policy changes along with behavioral data and local footfall data, you should have a better idea of when people will return to the high street to shop. Now, we'll have our first deep dive on mask wearing behavior available in a few weeks' time. I would encourage you to come back to the Imperial College London and YouGov coviddatahub.com or to the GitHub page to download this data for 29 countries for free. At present, for example, we're looking at the differences between the higher and lower stringency countries on wearing a mask in public. Higher stringency countries are wearing masks in public always or frequently 73% of the time versus 49% of the time for lower stringency countries. So this obviously has implications for virus transmission rates. Now, an important consideration in life during and after COVID is life satisfaction. We will have much more to say about this in the coming weeks, but we will be announcing soon that the global leaders in this research are joining the Imperial College YouGov collaboration team, the team behind the World Happiness Report, including John Hallowell, Jeff Sachs, Richard Layard, and Jan-Emmanuel Deneuve. The World Happiness Report is a report published annually by the UN Sustainable Development Solutions Network. Life satisfaction provides a very powerful umbrella measure of the quality of people's lives. In the annual World Happiness Report, differences among countries and over time in these evaluations are explained by good health, income, and 4 measures of the quality of the social context: trust, generosity, having someone to count on, and freedom to make key life decisions. All of these elements are changing under COVID-19, often in ways never experienced before. The YouGov life satisfaction data, collected regularly as the pandemic evolves in each survey country, provide a very valuable barometer reading of life under COVID-19, reflecting each country's institutions and policies. Along with life satisfaction, good health, income, and quality of the social context, we are also at the start of a long research dive on depression and anxiety around the world. Early figures indicate that there may in fact be large differences in the global populations with worryingly low levels of what we might call normal or no symptoms as measured by the PHQ-9 in countries such as Japan, the UAE, and China versus, for example, what we are seeing in the UK. Now, why track behavioral data and not just attitudes? For those of you who are familiar with the now ubiquitous R number, this may make more sense. but let me briefly explain the R number. First of all, R number is an estimate, and that is important to recognize. One easy way to think of the R number, or the reproduction rate, is the number of people a single person can expect to transmit the virus to. If a region has an overall R rate of less than 1, then the virus is reproducing at a rate which will not grow exponentially in a population. However, if the R rate rises above 1, then each person in the region, on average, is transmitting the virus to more than one person. And this is a rate which grows exponentially in a population. The R number, unfortunately, has to be estimated retrospectively because of the time lag between infection, symptoms, and recorded deaths. Now, at the bottom in purple, you'll see the ways in which the R number has the chance to increase. It's these behaviors that we are tracking with the ICL YouGov dataset. Let's for a moment focus on the lower right of this chart. This is crucial. Who is a case? Without widespread testing, we cannot know who is a case and who is not a case. Most cases are probably asymptomatic, meaning without symptoms. It is essential that each country take responsibility to isolate each case and look after them and the members of their household until all members of the household are healthy and clear of the virus. Their contacts need to be traced and notified. And it is this stage, setting up this kind of system, that many countries are in at the moment. Let's move to exit strategy on the health side for a moment. There are 4 exit strategy principles from a recent World Health Organization communication: infection status, community acceptance, public health capacity, and health system spare capacity. Now, infection status and how it informs lockdowns and exit strategy. There are 4 principles to watch here in order to predict what might happen next. One is the rate of infection, which is expressed as an incidence rate in a population. The second is the doubling rate of infection. Can you advance to the next slide, Will? Thank you. The third is case contacts, which is ideally expecting the number of cases generated per case to be 1 or less. That's related to the R number. And the fourth is the testing positivity rate in a population of less than 5%. Moving next to community engagement. Community engagement is very important. Without proper communication and engagement with citizens and local decision makers, the willingness of the public and of corporations and local public services to comply with measures such as these are unlikely. For example, engagement and willingness to avoid medium and large gatherings, whether they be social, religious, conferences, large sporting events, cinemas, gyms, theaters, etc. This also includes schools opening in phases and the acceptance of schools reopening. Now, the very unfortunate message that is also in this communication from the WHO, that there are consequences for companies and individuals as a result of the lack of coordinated preparedness that almost all countries have faced as a result of COVID. These include the likelihood of new and increases in taxation, and employees, public and private, possibly needing to accept reasonable reductions in income and benefits to account for these. Now, moving to the behavioral models. Are people complying with health directives? Will they do so if restrictions continue? There are many ways of attempting to answer that question, and one place to start is by looking at some of the evidence about what is known to drive people's health-related behaviors. The health belief model of health behavior is pictured here. It suggests that key drivers of a positive health behavior, such as stay home, include a person's perception about the severity of COVID-19 illness, a person's perception of their susceptibility to the illness, what they perceive as the barriers and benefits of staying home. Factors also include a person's general health motivations and the cues from their body or their environment that they receive about the illness, such as symptoms like a dry cough, public health campaigns such as stay home, save lives, and other cues such as ambulance sirens. But chiefly, there is a growing sentiment that among those looking at the data, that trust in health advice and trust in government are key to making these actions stick, such as stay at home. Now, paramount to all of your businesses is the health and welfare of your employees and your customers. And all companies are in need of forecasting while taking into account these uncertainties that have not been in the realm of brands before. And some of these constraints are well out of your hands, such as stores being shut. I want to spend just a few minutes looking at how models of how governments and even brands can plan their actions around consumer behavior and attitude change. Now, moving forward one slide here. Thank you all. We're looking at the ethical ways to nudge consumer behavior. This is called the Behavior Change Wheel. This is by renowned world leader in behavior change related to health, Susan Michie. On the outside in purple, you have the policy measures that surround people in their countries. Fiscal measures, such as stimulus packages. Communications, such as public health campaigns. And if we forward to the next slide, it's very unusual for countries to use all of these policies at once in lockstep. And this is what you have seen with COVID. Now, at the heart of these circles is the individual. That is the green. And we'll talk about how to get from purple to green in a moment. But let's take a moment to look at green, the individual. Where does consumer behavior originate? Every individual's behavior starts with their perception of three things: their capability, their motivation, and their opportunity. Individuals' capability is both psychological, their perception of what they're capable of, and their physical capability. For example, are people physically able to get into a store to shop, or are they confined to their homes? If shops are open, do they perceive that they can get in and navigate safely? Individuals' sense of opportunity is also driven by their sense of what they can manage physically, and it depends to a great deal on the extent to what they perceive as socially acceptable. Their motivation is driven by both unconscious thoughts, automatic reflexes and thinking. For example, people are withdrawing from those around them who sneeze and cough without even thinking about it. And in a happier setting, this could be, for example, walking by a Cinnabon counter in a mall and your stomach rumbling without your permission. Those are automatic reflexes and thinking. But motivation is also governed by active thinking, such as, it's hot out today and I don't have any shorts to wear. I think I'll pop out to get a pair of shorts. Or I want to use public transport, but I don't have gloves or a mask, so perhaps I'll stay home. Now, advancing one more slide, it is here in the orange and pink rings that both public health bodies and brands need to think about when it comes to shaping individuals' behavior. So to shape the green parts, the individual, the orange and the pink rings are what is in your toolbox. And you can combine them in any way except coercion, which is not ethical. For example, you can use persuasion to promote optimism, and that influences consumers' capability, motivation, and opportunity. I will skip over what the public health bodies are doing and give you my thoughts on how brands need to plan for economic recovery in terms of consumer activity. So for example, some brands may use incentivization in the pink, such as discounting or launching new ranges, to increase intentions in the orange. And the idea, of course, is to influence the green, the individuals, their capability, their motivation, their opportunity. Many retailers will also be using restructuring the environment in stores, which is in the pink ring, to do the orange, which is shape beliefs about the consequences of shopping in person. This ultimately has influence on the green, the individuals, their sense of capability, motivation, and opportunity. I would encourage all brands to lean on this models or models such as these to keep the context of the purple, the government policy, in mind when you're planning your activities. And again, if you have questions about this model, please don't hesitate to get in touch by emailing info@yougov.com. And Will, with that, I'll hand it back to you.
Fantastic. Thank you so much, Sarah. That's really, really interesting, just to understand. You know, we've heard so much in the UK, for example, about the R number. Really, really interesting to understand that. Really interesting to understand how consumer nudging behaviour can be influenced. Right. We're on to your agenda. We promised to leave 15 minutes for questions at the end, and we are absolutely on time. I think maybe a minute late. So if you do have any questions, please do use the chat functionality and put them in there. And I'm going to just fill for a minute or so by telling you about what's coming next while you do that. So if you do have any questions following this webinar, you know, as always the way, as soon as you hang up, this should have asked that one. Please do get in touch, either through your local YouGov contact, or you can hit our global email inbox, which is info@yougov.com. Couple of things worth noting in terms of what is coming next. So YouGov is continuing this webinar series. We're repeating this one for our audiences in the UK, the USA and mainland Europe later this week. We're more than willing to tune into those, where Gavin will be shifting the focus of the data away from APAC and into those relevant geographies. But we're also continuing our webinar series beyond this. The next one coming to APAC is around our connected data. So looking at brand index, looking at YouGov profiles to understand how the stories that we can tell as a result of the virus so far, in terms of how that is impacting brand and how that is impacting audiences. Proves to be really interesting. We've got our one of our global marketing insight directors looking at that for content, and I've seen an early draft. It's really, really good. So please do stay tuned for that. And then in about 4 weeks' time, we're going to come back with an update on our consumer monitor and economic confidence. It will be about 6 or 7 weeks since we've last updated you on that. So we will be delighted to come back and say that. Right, I'm delighted that some questions have been coming in. So I'm going to throw to Gavin first. Gavin, what have you seen on the questions that you'd like to pick up on?
Thanks, Will. Yeah, so the first one in there, so Sarah mentioned that trust in government is important in determining whether behaviours stick. So is trust in government a disposition, or how else can it be earned during this period of time? Does that specifically relate to what you're talking about, Sarah?
Absolutely. I believe that, and I think the data will show that trust in government is stable in some individuals more than in others. And I think the evidence that we have of that is that the trust in government, for example, in the UK has wavered quite a bit in recent weeks. I think that the longitudinal panels show that in some individuals, this is very strong. And with some, the COVID-19 policy communication coming from governments has not been beneficial for those attitudes in some. As to the question, how can it be earned during this period? I think that the WHO would probably say that transparency from governments on what is happening, why, and how they are fixing it is the way to improve this type of unstable attitude. I firmly believe that being transparent with the data and the methods by which the scientific advice is being operationalized by governments is essential here.
Fantastic, thank you. Is one question that I've seen coming in here from Julie. Do you have any data on consumer intention to get back to the leisure or entertainment activities, in particularly family activity in the Middle East? We do have consumer intention data. It's not within this behavioural health data set. We do have data in our consumer monitor. If you email us at info@yougov.com, we can share with you extracts from the last webinar, which did cover some of that. We also, within YouGov Brand Index, track various funnel metrics. So looking at whether people are aware of a brand, whether they would consider it, whether they intend, and their customer status. We do cover a large number of sectors, and we also cover in-market sectors. So whether people are likely to purchase within the next given time period, be that 30 days for something like clothing, or whether that be for something like 12 months for travel and transport. But it's an interesting question because that will also feature in our next webinar. Going back to Sarah or Gavin for anything else that you've picked out of the questions.
So there's an interesting question there about health and well-being, and whether the agenda around health and well-being may gain in importance post COVID-19, and could possibly be sort of shifting GDP out of the way a little in terms of assessing the performance of a country or a society. I think that's a very interesting question. I think what I've seen in the UK and in other countries is that in this public health tracking work, we've not lost sight of the mental health element of all of this. That's kind of at the root of our introduction of the PHQ-4 questions into this study. I know from other work that we're doing in the UK that we are tracking a number of other mental health indicators for government agencies, and indeed physical health indicators for those that are focused on outdoor activities. And I think everyone would probably see that there is often a narrative in a lot of the coverage of the pandemic, which seems to be trading off economic activity against health, against personal health and public health in the form of health and well-being across society. I think that it's obviously important that it's not being left behind in the coverage, and I think so. It's important that we are tracking that information, and it's encouraging that public health organisations haven't forgotten about it either. So I don't know if Sarah's got any views on that as well.
Well, absolutely. We are, this is particularly for Rayanne's question, we are looking forward at Imperial College London, and in particular the ICL YouGov COVID collaboration, to supporting life satisfaction as an important measure, as a key indicator in alongside GDP in the economic sphere. And that is exactly the reason why we're partnering with the World Happiness Report team, Jeff Sachs, John Hallowell, Richard Layard, and Jan-Emmanuel Deneuve, shifting the attitudes within governments about which KPIs every nation should target is extremely important. And from our perspective, we believe that partnering with high impact teams is the way to encourage that. And we feel very lucky that YouGov is providing that data pro bono for ourselves and for that team. Interestingly, there is also strong evidence that life satisfaction is a key driver for voting behavior. And I think that will become much, much, much more important in the coming 5 months, for example, before the US election.
Fantastic. Thank you both, Sarah and Gavin. There's a really interesting one actually that's come in. Sarah, I wonder whether you are able to pick up on it, but I'll give you some time to think while I answer something else. Do you have any data estimating the number or proportion of asymptomatic COVID carriers? But while you think about a response to that, I'll go to some of the questions that were asked pre this webinar. So when we did send out invites, we asked people what questions they would like to ask us, and I've got some of them here. One particularly interesting one: what impact has COVID-19 had on alcohol consumption and sales? There's been lots and lots of talk about it in the press. Especially in I can say in the UK and the USA in particular. What we have seen from our data is while there has been a small increase in total consumption, it's not as large as you might think, but it's squeezing the overall toothpaste tube away from on-premises, so in things like bars, pubs and restaurants, purely because people aren't able to get there, into the off-trade. So that's it's done far more at home, which looks therefore it's like a spike, but there's not a overall dramatic spike that we can see thus far in people's reported alcohol consumption. Sarah, coming back to you, if I may, on estimating proportion of asymptomatic carriers.
Yes, of course. This is a question from Imelda. Unfortunately, this is the most unanswerable question that we have at the moment due to the lack of widespread testing in countries. The best estimate, for example, that the Lancet has is that 50 to 80% of the population is the attack rate of unmitigated virus. This is, for example, what we would call, without interventions. However, without widespread testing, you simply don't have a denominator underneath that proportion. And this is what the WHO has been encouraging since as early as January, that widespread testing is absolutely essential in order to understand not only what the attack rate is, but also which people in the population are most susceptible and which population are, how can you characterize the asymptomatic carriers, such as children. For example, we do know that children are less likely to be hospitalized, but we don't know very much about the attack rate in children of those who are asymptomatic. And those kinds of questions are key to confidence in, for example, returning children to schools. There's another interesting question from Rayanne about how can citizens in more authoritarian regimes recognize they're being victim to coercive behavior nudging. This is a very difficult question to answer, and I think that the most obvious response is a free press. In my opinion, that is the key to transparency and information. In many authoritarian regimes, there is no free press. And in some non-authoritarian regimes, the press seems extremely biased. And the suggested methods to regain the autonomy and respecting the guidelines, I think that this is a time when scientific advice needs to use all communication methods possible, especially social media. And it's the responsibility of social media companies to monitor misinformation, disinformation, and fake news and eliminate it from the population. As in authoritarian regimes, it does seem as though social media and non-state controlled media, such as social media, is the only way, for example, to speak the truth about the science. I hope that answers your question, Rayanne.
Thank you, Sarah. That's, I'm afraid we are at time. Thank you all, for those in the audience, for your participation this morning. Thank you to Gavin Ellison from YouGov and to Sarah P. Jones from Imperial College London. I'll just open up the mic for them to say goodbye.
Bye. Thank you for attending. Thanks.
Thank you so much. It's been a pleasure to address all of you.
And it's goodbye from me, and thank you very much. A copy of these slides and recording will be available after this, and we will email them to you. Thank you very much, and have a good day.